Hi, this is Dr. Greta McLaren and I'm at Skin Secrets today, and this is going to be a live video demonstration of the product Sculptra Aesthetic. For those of you who are interested in this, Sculptra Aesthetic did an amazing job on their website, kind of showing the transition of how this can continue to improve your volume over a good 2 years. I would encourage all of you to look at sculptraaesthetic.com if you want to see some actual photos of how this product really works over a good 2-year period. Mary Beth's here today. How old are you, Mary Beth?
50.
So Mary Beth is 50, and the biggest thing that I understand is that as we're aging, we're losing bone. We're losing bone underneath, we're losing fat, and we're losing muscle. So if all you do is a facelift and you pull everything back, you're now pulling skin back tighter over a older looking skeleton, which is where you get the really unnatural looks. The way to get a really natural look is to start adding that volume back to add to the bone loss, the muscle loss, the fat loss. There's several ways you can do that. You can do fat transfer. We can do the fillers, which a lot of people are familiar with. We use Voluma, Jupiter, Radius, Restylane. The reason I like Sculptra so much is Sculptra is such a natural look. It takes time to see the result, but when we put in 2 vials, I put in 1 vial for the upper face and 1 for the lower, it will continue to grow her collagen over a good 2 years. And the nice thing about this is it would be like putting in 20 syringes of filler, because I'm going to do all the areas, whereas each area would take a syringe of filler. It's very easy to have done. It looks almost like water, so it's very simple to put in. There's lidocaine in this product. Mary Beth has no medication. You're feeling fine, right? And you're going to see how easy this is to put in. Now, if you look at her, there are several areas that are really important. So I'm going to start at the cheeks, then I'm going to go up here and down. The cheeks, we always lose volume, right? When you're younger, everything's nice and smooth here. As you age, you start to get volume loss, especially in here. You start to lose the lift up here. So you really want to keep your cheeks full in a really natural looking way. I really think that people that keep their cheeks up, that's probably one of the more anti-aging things you can do. And I'm going to show you how simple this is. Now, Sculptra has lidocaine in it, so it's going to number as we go. It goes to the bone. It really works best if it's injected down on the bone. So all I do is lift her cheek up, and I'm on her bone right now. And I'm putting this in, and you're doing okay, correct? And at the very end of this, you can actually see the volume that I put in, but the volume's going to go away in about 48 hours, and then it's going to continue to grow her own volume over 2 years. But you can easily kind of get an idea of what I'm trying to accomplish, because you're going to see the fluid in her face, and that's like putting a filler in. And so when I'm done, you'll see how much volume makes a difference for her. So I'm doing 3 in her cheeks, because I can just tell by looking at her that this is where I really want some volume. This is pretty typical of somebody who's 50. Mary Beth has actually had this done before, and you like this product, right? But it's been a while. It's probably been a couple of years since you've done it. How you doing?
Good, really good.
Another really important area to do is you can almost run your fingers here and feel this go in here. Believe it or not, this is a really aging kind of look when you start to get volume loss here. It's really important to fill this in, and everybody can just run their fingers here and feel the volume loss. Once again, could I do this with filler? Absolutely, but Sculptra is kind of nice to be able to do the whole face, and then it's going to continue to improve for 2 years. So the way I do this is I'm going to have you open your mouth a little bit. This may look harder than it is. She's fine. We always want to withdraw, make sure there's nothing there, and then I put a syringe in here. You can see she's bleeding a little bit, but it's really tiny. I doubt she's even going to bruise with this procedure. I'm going to finish 1/2 of her face, and then you can compare it to the other, and I'll do the other half when we're no longer filming. Okay, so now I've gone through here, I've gone through here. I want to do a little bit in this nasolabial fold right here. This is also another good place to go. This is the one area that I think can smart just a little. She's numb everywhere I've gone so far. And then I'm going to turn her this way. This is another area that when you do a facelift, it looks very fake back here. Because if you just pull the skin back and you don't put some of this volume back in around this ear, that's where you get that facelift look. And I don't like that look. I don't think it's a very natural look. And we are almost done with this whole side of the face, and that's how fast we did this. So now you can see she's just bleeding in a couple little places, and that's probably going to stop by the time I'm done. Chin up. Another area I really like is to accentuate the chin. We start to lose our chin. It literally separates from our jawline as we age. So what I mean by that is this becomes a round little chin that totally separates from the jawline. And you want to keep this one straight jawline for the most part. So we're filling this in again. That bled just a little. And honestly, I can tell by looking right away when I'm doing this, she's probably not going to bruise at all. She's bleeding just a little bit from the superficial needle injections, but I don't even think she's going to have an issue with that. So now she's done on this side, and then we massage. See, all these are stopping because this is just where the needle went in. And so if you look at her now, hopefully you can appreciate the fact that she has more volume on this side of her face. And that's our goal for her. And we're going to do the other side of the face. But how was that for you?
Easy, no problem.
And these will stop usually within a minute. And like I say, I can kind of tell by looking at her. I don't think she's going to bruise. I can never guarantee it, but I don't think she's going to bruise with this procedure because these look like they're just the little needle marks that want to bleed a little bit. And so once again, this is Dr. Greta McLaren showing you how we put in Sculptra Aesthetic. It lasts for approximately 2 years, stimulates your own collagen and grows volume. And I would advise you to go to the sculptraaesthetic.com website if you want to see more photographs of how this can improve over 2 years. Thank you for watching. Good.